All right, we're going to talk about exercise and the amazing benefits. And it's not as hard as actually you make it out to be. We'll go through the physiology. So we're going to talk about the clinical application of the research, the advantages of exercise, and exactly what to recommend: timing, type, intensity, and duration, much less than you think you need. So what is your favorite exercise? I like this. Is it chewing? Or is there some type of exercise you particularly enjoy? Another question, true or false? Intense exercise is an efficient weight loss strategy. And that answer is false. Intense exercise is actually an inefficient weight loss strategy. So we have three divisions of caloric energy. Metabolism is the inner fire. Activity, how much you expend with what moving around during the day. And digestion. So of those three, which is taking the most calories? So the distribution of caloric energy puts metabolism at the very highest at 70%. Activity accounts for only 20%, and digestion only accounts for 10%. So basically, exercise is inefficient for weight loss. And keeping a high metabolism is the most efficient way to maintain a low body fat. Remember that if you starve yourself or calorically restrict yourself, you will develop a drop in metabolism. So very inefficient. So what about exercise increasing the metabolism? And actually they've done several studies. There was one of a weight training study where they had people at 24 weeks of weight training, and they measured their resting metabolism before and after. The results showed that men did have a 9% increase in their resting metabolism. Women had only 4% increase. But the conclusion was that the improvement of the increase was so mild that it probably is not clinically significant. So the science is in, exercise is not the best way to lose weight, but it's a great way to maintain a weight loss program. Exercise alone is not efficient for fat loss, but it's great for multiple other reasons. One of the things exercise does is it gets these anti-inflammatory cytokines released. So myokines, myo means muscle, comes from exercising muscle, and adiponectin comes from brown fat. So exercise increases brown fat and increases these anti-inflammatories. So myokines are the healthy cytokines. They also target the hypothalamus. And the hypothalamus is in there in the mammalian brain, and it results in improving leptin sensitivity, meaning that you get satiated easier. So you get the appetite suppression, and you improve mood. So it decreases depression. With muscle growth, you improve insulin sensitivity. So it's extremely good for people that are prone to type 2 diabetes. Okay, let's do a case scenario. See how you'd handle grumpy uncle. He's 56 years old, he's overweight, he's got hypertension, type 2 diabetes, doesn't care about anything, including his health. His wife wants him to start on antidepressants, thinking that will help. So the following choices, what would you recommend? Would you buy him a gym membership, put him on a weight reduction diet, begin antidepressants as soon as possible, or encourage him to begin an activity he enjoys? So it's encourage him to begin an activity he enjoys. Problem with a gym membership, of course, you can lead a horse to water, but you can't make him drink. And it just makes you feel bad. Antidepressants, the biggest problem is that most of these medications are classified as obesogenic. They actually increase weight gain. So they're only used if recommended strongly by a physician. And in addition, I have to really make a warning here that you never stop antidepressants cold turkey. You can go into withdrawal, have psychotic episodes. So I would say that to anybody listening, that if you are on antidepressants, you would add an exercise program to your schedule and then work with a physician or a therapist to wean off slowly antidepressants. And the other is calorically restricted dieting causes someone to be hangry and tired. So you're gonna make it much more grumpy. So myokines from active muscle reduces inflammation in the hypothalamus, improves leptin sensitivity, reduces appetite, and improves mood. Another case presentation. Actually, this is a true story. This is a friend of mine. The hospital, 57 years old, pretty high BMI. She wanted to begin an exercise program, and so she began it gradually by walking, simply walking on a track at a local gym. So while at the gym, a shot is heard from across the track, and she falls down to the ground. So what happened? Her ex-husband shot her. That could have been a possibility, seriously. She had a heart attack when someone broke an exercise machine, made her fall down, or she ruptured her Achilles tendon. And this is what happened. She actually did rupture her Achilles tendon, and it does sound like a shot. The problem is that due to excessive weight, it puts way too much pressure on these supporting structures. So even though walking may be considered in your mind a very low intensity activity, for some people with high BMIs, they can't even support this type of exercise. So a non-weight bearing exercise would be something to start. Otherwise, you end up all the way back at the beginning. So let's talk a minute about these supporting structures, bones, tendons, and ligaments. So here's a case, two cases, a 34-year-old woman back from a mission at a space station, and an 81-year-old woman who enjoys dancing. Question, who is more likely to break a bone? The 34-year-old or the 81-year-old? This is kind of like a trick question. And the answer is a 34-year-old, directly back from space. So returning astronauts have zero gravity. When they come back from a mission, they actually have to be carried. The first astronauts, when they got off out of their space pods and onto a boat, they would immediately break bones. So they have to be carried, and they have to gradually get back their bone deposition. And this is a YouTube that I would recommend you watch. This is the 81-year-old dancer called Granny. She gets up, swings around, a very active dance competitor. So basically, gear the exercise program on the physical state of the individual, not the age, but the physical state of what their bones can handle. So here's another case scenario. Your 40-year-old aunt has lost 20 pounds. She's done it through sleep, fasting, stress management, a healthy diet. Now she wants to begin an exercise program. So how hard should she exercise to maintain her 20-pound weight loss? Should she do it mild so that she can carry on a normal conversation? Moderate, the definition of moderate is can still talk, but just short, brief phrases or sentences. Or should she do an intense workout, too breathless to even speak? The answer is moderate. So this was a study question. How hard should a person work to maintain their weight loss? And it's a J-shaped curve. More is not better. They found that medium activity, just moderate activity, ends up having the lowest caloric intake, so it depresses your appetite suppression at a medium activity level. So very high activity actually causes a person to try to match their expenditure. So very high level intensity activity increases risk for injury, but also increases appetite. And low activity, you get virtually no appetite suppression. So we're going to leave high intensity exercise for the highly competitive athlete. So another case scenario, someone with rapid weight loss. Granny's been overweight for as long as you can remember, but she's lost 20 pounds in the last 6 months without even trying. Should you be happy or worried for her? Actually, this is a situation where you're always worried about someone that's had an unintended weight loss. They can be caused from acute stress, cancer, infection, or actually depression can also cause an unintentional weight loss. True or false, an exercise program is not needed for the elderly population. I hope you're going to say that's false. They've done some clinical research in this, and exercise in the elderly population improves muscle mass, improves bone density, particularly weightlifting, increases the metabolic rate. And whether or not that's clinically significant is in debate. So as you grow older, if you don't move, you won't move. And this is an 88-year-old figure skater. So in summary, metabolism accounts for 70% of your energy usage. So you want to keep your metabolism high. The advantages of exercise, we talked about the myokines, the anti-inflammatory cytokines, and that moderate activity is the best for appetite control and for weight loss maintenance. And the recommendations you make for exercise should be for safety and sustainability. So, in other words, make recommendations that don't offend, that are safe, that are individualized, and that will be sustainable, so allow for choices. And the other caution that I want to point out is that for someone, particularly like the example I gave is the grumpy uncle, always make sure they have a medical clearance. With someone with diabetes, you might not have the same symptoms for a heart attack. Diabetics actually destroy some of these nerve cells. So the innervation to some of the pain other people would get with having a heart attack, they may not feel. So they need clearance on that, especially for people with high blood pressure and their risk with resistance training. Any questions, please leave comments. Love to hear from you, and there will be a PDF on the link in the comments. Thanks.